welcome back, Dr. Layon. It's a comrade, uncle, intensivist, all around good guy.
Thank you, buddy. That could be the title of the podcast.
Yeah.
Comrade Uncle.
Yeah, that's kind of what I was thinking. I like it. That's what I'm talking about. All right, so I got some questions for you. Are you ready?
Sure.
All right. Listener JM asks, if you are fully vaxxed and still get COVID, should you get treatment or just ride it out?
Well, if you're fully vaxxed and you get COVID, the odds are, all things being equal, that you're going to have a relatively mild case of the disorder. You still have to worry about long COVID. So, frankly, if in my opinion, I don't know that there's a best practice on this, but in my opinion, I would say you get treated with the 5-day course of Paxlovid, which is the antiviral medication, which really does work quite well. So I would definitely do it. I would really take little chance with the possibility of getting long COVID. That's between 2 and 3 out of every 10 people who get COVID, doesn't have to be severe, develop long COVID. I would not mess with that.
Yeah, I have long COVID. It is not fun. I would pass on it given the choice.
No. Yeah. What symptoms do you have?
Boy, man, you name it. It's kind of over time it has changed, or rather not changed, but some of them have diminished more than others, especially with boosters. Mm-hmm. But to start with, of course, shortness of breath, brain fog, insomnia, kind of some mood stuff.
For how long? Has that been going on?
That's since I got it, basically. I mean, and then there was a dramatic decrease.
But how long is that?
Since 2019, since January, yeah.
Really?
January of 2019, yeah.
2 years later.
Yeah, 2 years
20,
later.
2020. 3 years later.
Yeah.
3 years later.
3 years later.
Wow.
Yeah, I'm a long hauler.
Has it improved or is it the same?
It improved dramatically. The first vaccine that I got, it improved dramatically. And that was like, a lot of, other stuff, loss of smell, post, exercise malaise, so after I stand, mm-hmm. even stand a lot or work out, I get like kind of like muscle joint pain, kind of like if you had, run a marathon or something, worked out really, really hard. And then, but just kind of out of all proportion with the amount of what felt like the amount of, exertion. Yeah. So, and then, the first one, vaccine, it got like a lot better. I gained a lot of my smell and taste back. Kind of a lot of the mood stuff went away. It's still, sort of there, but like way, dramatic decrease. Insomnia didn't really get any better. Most of the smell stuff, still lingered on. And then each successive one, was pretty minor, like sort of, decrease in symptoms. And
each successive one, you mean each improved.
Yeah, right. Yeah, the second course, or I'm sorry, the second. So I did the what do you call it? The Moderna. So the 2 main full doses, and then boosters after that. I think like 3 or 4, something like that. Boosters, very very little, especially with the boosters, very little until the bivalent Omicron booster. And there I noticed a kind of, by then I was starting to pay more attention too. So maybe there's some of that, where I'm like really like monitoring, stuff, as opposed to just kind of stumbling around, not realizing, what's going on. But the bivalent vaccine, surprising, booster, whatever, surprisingly seemed to change a lot. Like almost all of my smell is back. I went from kind of the only upside, I would say, pretty much the only upside, would be that I couldn't smell cigarettes for a really long time. it was great. I mean, truthfully, like if I had a switch, that was awesome. And then
Right.
I got the Omicron booster, the bivalent Omicron booster, and for the 2 strains, and that came back. So,
well, it's interesting. I don't. I mean, I'm not 100% sure how to explain that, except with, as I mentioned earlier, the one study that's now been released that shows virus, and I'm assuming active virus, but I could be wrong on that, everywhere in all organs. And so possibly being boosted and reboosted has made it possible to somehow clear some of that. I don't know.
Maybe it's just, it could be, look, I mean, here's the other thing, right?
And maybe it's just time.
Yes, exactly. I mean, I hate to attribute one, it's like one of those things. You never really, I mean, your mind can create the association of being like, I got my thing and then I got,
right.
But I was doing breathing exercises, stuff like that. So, yeah.
Well, it's clear that there's not a lot that's clear. That's what's clear. Yeah. There's not a lot that's clear about long COVID, and it's being studied actively. It's a problem, Odie.
Yeah.
It's a problem, and lots of people. Again, as I mentioned earlier, people say, where is everybody? Well, 1 million people are dead, and 20 to 30%. That's 20 to 30 million. Yeah. I think there was 100 million people who have gotten COVID. 20 to 30 million of those people have long COVID.
Yeah.
And it's like, that's where they are.
Yeah.
That's what mismanagement of this disease has done. And I blame that fully, completely, and utterly on Trump and his minions.
They did not help, did they?
Mismanaged it. No. To not help would have been to stumble through and make mistakes. They purposefully downplayed this. He purposefully did this. This was worse than that.
But what about? I mean, now, like, so my kind of, okay, like I look at the Trump policies, and then I look at, the sort of the current Biden policy, and while I do see a difference in the sort of messaging, the lack of a PR campaign, the sort of basically peeling back, and maybe that's totally justified to peel back restrictions to the point where we're at. I see, and changing a critical one for me is the changing of the model. Now, granted, I know that, the reporting from the CDC, the reporting that we're getting back from hospitals is different now. But they also changed the model to this, community-based, spread model. And that is, kind of chronically underreports because it just sort of, it wings it. And the way that they choose to interpret the data kind of downplays the severity. So we have a ton of cases going on, most of those going unreported. No effort on the part of the government to even estimate that. Their calculations are all based on what limited data they're still receiving, which is ever decreasing as free testing closes, so my kind of view of this is, yes, there's 100% a huge, a big chunk of the fault definitely lies with Trump. Absolutely. Set the tone. But then now I look at the Biden administration and I don't see them doing anything in terms of material, anything terribly different. I see them making they aren't even really telling people about the booster, right?
Well, yeah, no, I some of your critique, I think, is legitimate. There is, look, Biden administration is a conservative Democratic administration. Right. It is. Right. They do, however, recognize the primacy of science when it comes to medicine and disease. That's for sure. There are things I've disagreed with them on. Like, for example, I think the making masking optional, I think, was a mistake.
Right.
That's what I think. Now, again, don't misunderstand me. The CDC, there's some incredibly smart people there. I do not hold myself out to be as expert as they are about this.
Sure.
But just knowing what I know and seeing the cases and seeing what happens, I think that the limitation of masking, making masking optional, I think is a mistake. And I can't prove it. I think it was basically done for political reasons,
right.
Not because the Biden people are corrupt, but because they were getting flack after flack after flack after flack.
Right.
And I think that's going to end up hurting us.
Yeah. Probably.
I have seen and heard, now it may not be enough, but I have seen and heard advertisements, media for the bivalent vaccine to go get it and stuff. But you're right about what I think you're really, really right about is this thing is not behind us. If I'm not mistaken, Biden did say at one point, I forget whether he said it's over or we crossed a Rubicon or it's behind. I forget the phraseology, but the implication was it was, I think, and again, I didn't come prepared having reviewed his material.
Yeah, I know.
But I remember hearing this, and I
things to that effect at the very least.
And I don't at all mean to put him in the same category as Trump ever, but I do think it could be more aggressively. I think it could be way more aggressively attacked in media, with campaigns. And I think masking just has to be done. It just has to be done. Okay, you don't want to keep your kids at home. I mean, you can't. I mean, there's a million reasons to not do that again. But the masking stuff, for example, I just think it is one that's not perfect, doesn't solve every problem, but it's the right thing to do. So there are differences, but it's not what one would hope. And then the question is so then what would one hope, right? We talked earlier about the Chinese model, which, at least initially worked. It didn't work to solve the problem. It worked to buy them time. But the time, I think, wasn't used the way it should have been. I mean, again, any government, any country, any public health people, any physicians, we can all make mistakes. But I think that was a mistake. I think one of the things that was done right here, certainly once Biden got in, was immunize the world, immunize everybody in the country. Just do it. I think it's the right thing to do. I think, the wrong things, there are several wrong things. One of the wrong things was that it's a pandemic, not an epidemic in the U.S. It's a pandemic. We should have been much more aggressive about making basically all this vaccine free.
A global initiative.
Anyone and everyone in every country.
Yes.
Exactly. This will come back to bite us in the bottoms again. And again, it's the system we have is performing exactly the way it was set up to perform.
Right.
It's not what you and I would want.
Right.
But it is performing the way it would.
The way it's set up.
There are tons of really smart people who know what to do and how to do it, and I don't think they can do it. But anyway, so I would say, what was the question? Actually, I forgot what was your question. The question was, what was your question? To get treated or not?
Yes. If you're exactly. Should you go in for treatment? Should you get treatment if you catch COVID? Even if you're fully vaxxed?
Well, to go in for it, you would call and you'd get a 5-day course.
They asked, should you get treatment? That's it. So, should you go in or not? And should you get treatment? Maybe I should ask you that.
So I would say the Paxlovid, yes, I would take it. 5-day course, relatively safe, good drug. Should you go get monoclonal antibody? I wouldn't waste my time.
Really?
Omicron it evades those. They don't work. But the Paxlovid, I would do it. I would do it. I would.
All right. Excellent. All right. So next question we have from DR. What is the immunity difference between getting a booster and getting actual Omicron?
Yeah, that's the question of natural immunity versus quote artificial immunity. There's no such thing. There's no difference.
Right.
There is no difference. You just don't know if you've gotten the disease, how much protective immunity you've got. You do know once you've been immunized that you will. So even if I've been lucky so far, I've been careful. I've not had the disease. But had I gotten infected, I would have still gone. After I was over the infection, I would have still gone to get immunized and boosted continuously, because immunity of any kind, I mean, it's all natural immunity, for God's sake. I mean, it's your immune system working, doing what it's supposed to do.
Right.
It does wane after a while. And remember, there's 2 components to that, at least. There's the humoral component, and there's the cellular component, which normally measured as the humoral component, which does wane relatively rapidly. But there are cells that remember, right? and they will reboost. They will remake antibody if you see the same antigen again. But the cellular mediated immunity, those guys hang around, and that's probably better and more important for viral infection. But infected or not, I would get immunized and boosted and keep getting boosted, because the immunity appears with this disease to wane relatively rapidly.
Right.
Tends to wear off relatively rapidly.
And the Omicron booster, I mean, it is a bivalent vaccine, so it is for more than one strain. Just like when you get the flu shot, it's for whatever 3 to 5, I think, something like that.
Whatever you think.
Right.
Yeah.
Right.
Yeah.
You get vaccinated against more than just the one strain that you got. So you will get more, especially with the booster. I mean, it also seems to be more effective, but even beyond that, the booster is because this latest one is bivalent, will give you for sure at least more protection against those two strains, if nothing else.
So the beauty of the mRNA vaccine is that it can be rapidly altered, and the virus itself. I mean, so there is when you study virology, one of the things you learn is that DNA viruses, smallpox, are different than RNA viruses, COVID. In that the former DNA viruses don't alter as much when they grow and in a body and get transmitted. They don't really alter very much.
Oh.
RNA viruses are much more prone to modification as they infect other hosts and grow and multiply and so forth. And so there's been multiple alterations in the COVID virus. Not all of them have been a problem. Some of them make the virus just die.
Right.
Some of them make it more infectious but less lethal, Omicron.
Right.
The one that everybody's afraid of is the one that makes it more infectious and more lethal,
Right.
which we haven't seen yet.
Right.
But that's the fear. So the beauty of the mRNA vaccine is that it can be altered relatively rapidly to changing conditions in the virus that is the predominant virus. And that's the beauty. That's why one gets boosted again and again and again with this particular disease.
And our immunity seems to wane relatively quicker than we would like.
Yeah. I mean, our immunity for lots of things doesn't wane, but for this it does. Why? I don't know.
Yeah, right. Who knows? Or maybe
somebody knows, but I don't.
Yeah, right. Okay, all right. So I think that's pretty clear. The immunity difference between the booster and getting the actual Omicron COVID, the booster is better. Get it. All right. So next we have from SM, thoughts about long COVID and brain fog, causes, remedies, supplements, and treatments. So kind of what we were talking about.
Yeah. I mean, so we've kind of touched on it. It appears that the virus invades all organ systems and sits there. It's not clear. That part from the post-mortem studies that has just been reported, that's pretty clear. There is, to the best of my knowledge, one study ongoing looking at Paxlovid to treat that. I don't know. It's ongoing. I don't know what's going to happen. Supplements. I mean, look, if you decide you want to take vitamin C or zinc or I don't know, whatever, it's probably not going to hurt you. Probably. But supplements, there were people who were earlier insisting on hydroxychloroquine and ivermectin and stuff like that. I mean, I wouldn't do that. I don't think the supplements will help, honestly. I do know that there is a group that has argued for high-dose vitamin C and so forth. I know some of those guys. They're smart guys. They're good guys. I think they're wrong. I think the data has shown they're wrong. I don't think it will matter. But if you want to take 500 milligrams of vitamin C every day because you think it makes it better and a little bit of zinc, it's probably not going to hurt you. I don't think it's going to clear anything. I don't think it's going to help.
Right. Let's see. What else? What remedy, supplements, treatment? So is there? So the treatment, the only real treatment that we're looking at right now, seems to be And you should, I should say, you should talk to your doctor. Talk to your doctor. Keep talking to your doctor. Send them a message on my chart or whatever. Things will change, and we'll try to do updates. But it's possible that something between now and maybe even when you listen to this will have changed. So keep an eye on it and keep asking. Keep in contact with your doctor. Maintain an open avenue of communication. So I can tell you what worked, what maybe worked for me, aside from getting boosted, which you should do, and maybe that helped, maybe it didn't. Time, of course, but I saw there was one study, another preliminary, and because it's so low cost, I think that it's worth at least trying. And what people were looking at was, they're basically doing square breathing, so like deep breathing exercises, maybe seem to kind of help or possibly could help with the overall long COVID symptoms. I don't know. It was just a preliminary study. I think they're still going through it. They're still doing it. It's one of those longer term things. But if you wanted to try, it seemed to sort of help, at least with some of the shortness of breath stuff. If nothing else, just because I think that doing breathing exercises in general is probably good for you. There's, especially if you have, so I've had asthma all my life. Having activity, getting up and walking around, and also, of course, anything else. I mean, this is sort of like stuff that isn't going to hurt you, and you could definitely try. Square breathing, in for the count of 4, hold for the count of 4, out for the count of 4, hold for the count of 4, and then repeat that for 2 minutes. And then you have to do that twice a day, basically, according to this study that is super preliminary and not a lot of, good data for. But, yeah.
That's actually interesting. So a couple of points. One is what you call square breathing is what we call, or not we, is what people who I have worked with call combat breathing. And it's meant to overcome the sympathetic discharge that you have with basically panic. So in through your nose to the count of 3 or 4, hold 3 or 4, out through your mouth to the count of 3 or 4, hold 3 or 4. And what that does is that triggers the vagus nerve, so it slows your heart rate down a little bit. And when you're jittery and nervous, and again, this is in a combat situation,
right,
which is not quite what you're talking about. It actually does help. If you're having a panic attack, it actually does help. That's point one. Point two. So I'm not making light of it at all. I'm not. But point two that I was going to say is in the ICU. When we've got patients who have respiratory failure for a number of different reasons. One of the things we do when they're able to come off of their mechanical ventilator, either invasive or non-invasive ventilation, is we use breathing exercises to try and make their lungs, I would say, strong. It's stronger. It's not the physiologic term, but that's kind of what we're doing to help keep things open and open them up better. And it really does work. So I can't think of a good reason not to do what you're saying at all. I cannot think of a good reason. There are some, so the big treatments initially were the monoclonal antibodies, right? Those really don't work at all anymore for the viruses that we're now seeing. Basically, the 4 new variants of Omicron. Paxlovid does work, and that still works. And so that's a treatment. If you get it rapidly after you're diagnosed, it really does help shorten the course and limit the risk of getting sicker. But the immunization is the thing that will really help. It's safe. It is, of course there are side effects. I mean, it is a drug. There are. But, whether the side effect you're looking at is myocarditis in young people, the risk of not being vaccinated and getting the virus, the risk of myocarditis is manifestly and manifoldly higher than it is with the risk with the immunization. Everything, there are risks, but they're quite low compared to getting the virus itself. So that's the thing to do, as we've said, to get it and to stay boosted appropriately. If you really do get sick and you end up in my ICU or anybody's ICU, there's not a whole heck of a lot we can do. There is the antiviral remdesivir, which isn't great. It does help a little bit. And then there's the utilization of this very potent steroid called dexamethasone, which you usually give after the virus is essentially gone or appears to be gone, to blunt the body's immune response. That's called cytokine storm,
Right.
which can actually is when the body itself attacks. When the immune system, it's our own immune system, attacks our body, and it blunts that. And there are some good data that that's helpful. There's really not there's not much else you can do. There are people who've argued using higher dose steroids. There's no evidence I'm aware of that helps. Using zinc and high dose vitamin C, no data. Is it going to hurt? Probably not. Is it going to help? No. So at least when the patients I'm caring for, I try and get rid of all the stuff that's just extraneous, that isn't going to do anything. Probably won't hurt, but that's just going to cloud the picture, and try and stay as much as possible with evidence-based medications, as much as possible. If somebody begged me to give them vitamin C, would I say no? Of course I wouldn't say no. If somebody begged me to give them ivermectin, that'd be a little bit different issue. In fact, I have had that happen.
Really?
And I was screamed and cursed.
Oh, man.
Oh, my God. I called names you wouldn't believe because I wouldn't do it. But it's okay. It's like people, I don't expect the families of the people I care for to be at their best, but I'm supposed to be at my best. So they can do all they want. And I try and maintain some kind of equanimity and deal with it because they're sick and they're scared. And as you said earlier, they've had the wool pulled over their eyes by some fairly unscrupulous characters in our country.
Right. Oh, so long story short, there doesn't seem to be a lot you can do. We sort of are kind of figuring it out. Maybe sort of a little bit. It seems to be in cadavers that were autopsied right afterwards.
So this is 40. There was 40 people who died with/of COVID. I have to relook at the study again. But what was important about the study is that in every organ system they looked at, brain, lung, liver, kidney, name it, there was virus. And that they're thinking that is part of the explanation for long COVID. It's not just it gets in your lung and messes things up, gets in your blood vessels and causes strokes. It is everywhere. And that may be the reason why we're seeing long COVID. And that's the rationale for the Paxlovid study that's ongoing right now.
Right. Oh man. Well, I hope to see some good stuff out of that. So keep on it. I'll put in the show notes. I'll put in links to the study, to that one, and to whatever anything else useful or relevant to this stuff. Okay. So let's see here. Next, how about this? And we actually talked about this a little bit. TM asks, should you go out to restaurants, stores, and bars unmasked, or should you still wear a mask?
So it's all that decision is a decision based upon how much risk you're willing to take. So when I go to like the market and stuff like that, when I go to the hospital, or in the hospital, I'm masked every day, everywhere. Full stop. When I'm in my little office writing notes, I take the mask off. But my friends and I, my comrades and I, my wife and I have gone to restaurants.
All right.
And we first say, well, shall we go? Some risk. Okay. Can we sit outside? If we can, we sit outside. Better. If you can't sit outside, I mean, I'm in Florida, so I can sit outside. But you're not, and you can't.
Yeah.
You say, can you seat us sort of away from other people? If it's possible, the wait staff will do that. And then we just take off the mask when we're eating and put it back when we're done eating. There's still risk involved. There's no question about it. But so the question is how do you navigate and adjudicate the risk, and how much risk are you willing to take? Excuse me. It's as simple as that. If I was going to go to a bar, which I must admit I haven't been to in a good while, but if I had a friend who came to visit and I was going to take that person to a bar to sort of, there's a really cool bar here in Gainesville called Crybabies, which I've been told, I don't know, is a really cool bar. So I need to go there. And if I was going to take a friend to that bar, we would not wear a mask in the bar. I mean, it would be absurd. Yes, there is some risk. I mean, there's risk. On the other hand, I would anyone that I know that I would do that with is completely up to date in their immunizations. So am I. And so you say, well, so the risk is probably relatively low. If I'm not immunized, I wouldn't do it. But again, it is the amount of risk, and
you would not do it if you were unable to get vaccinated or whatever. Then you would not do it.
I wouldn't do it. Yeah, I wouldn't do it. But again, it's because so it's on the one hand, to be clear, it's the risk that you're willing to take for yourself. That part's true. But the problem is it's not just you or me who's at risk if we don't mask, right? It's everybody we're around. And if we're around a parent or an uncle or a grandfather or a whatever, who's like old and frail and sick, you can put them at grave risk. If you get around somebody who's immune compromised for another reason, your age, but immune compromised, in other words, youngish, you put them at risk. Around little kids, you put them at risk. So, the way I try to argue this with patients who don't want to be immunized and family members who don't want to be immunized, this just happened a couple of days ago again, is, I say, look, if this was smallpox, right, what would you think, right? Because it's not just you're putting at risk, it's everybody around you. Because the R naught, the infectivity, right? The R, big R, 0, R naught, the number of cases that come from that are engendered from one person who's infected, and depending on the infectivity of the viral agent, it can be from 1 to 10 to 20, right? And in measles and in smallpox is quite high. Omicron is quite high. I'm purposefully not giving the number because I did not look that up before I came on this, and I can't quite remember, but it's high. So you're putting at risk not just yourself, which, that's your call. You can do that. But you're putting at risk everybody around you. And then finally, you're putting at risk the healthcare workers that you come to and you say, fix me. And, we're happy to do that. And that is what we do. But, if you get us sick and overwhelm the system, much like is happening with pediatric hospitals and respiratory syncytial virus, there'll be no place for people to go. And then what are you going to do? So I would ask people to sort of make the calculation, do what they think they want to do, but think about the others around you, directly around you, and people like me and my colleagues who are the people who are going to care for you if you get sick. You really have to be careful about this. I know I may be asking people to do more than most of us are willing to do, but I don't know what else you can say about that.
It's one of those things.
Yeah. You can't just stay in your house for the rest of your life because you're afraid of this. There is some calculated risk. All I would ask is that use what exists. Get immunized. Wear a mask. Wash your hands. When you can do it, distance. If you're sick and if you can do it, try not to go out. But then everything else is a calculated risk. And our health system should be better. Our national safety net should be better so that there are ways to do this. It's an embarrassment, an international embarrassment that we're so backward. But this is we have a massive military, $1 trillion a year for national security state, more than that, but we don't have the money for healthcare or childcare or. So this is something we have to change, and it'll probably be well after I'm dead, but maybe not after you're dead. So maybe you can do it.
Yeah, I hope so. I definitely agree. We need universal healthcare, truly universal healthcare. It is, and really we need a global something. We need to stop, like you said, stop treating it like it can only happen in one country, or you can only vaccinate people in one country, and we are all interconnected. COVID does not respect borders.
Does not.
And it doesn't respect class either. If you can't afford to get vaccinated, you can't. Not vaccinated. Jeez. If you can't afford to get, good insurance or take time off from work or whatever, Anyway, so yeah, so wear a mask and calculate your risk, and make sure that you take care of the people around you. And when you're making that calculation, please put healthcare workers into the on the scales as well, because I like my uncle. I want him to be around. Don't overwhelm him.
Thank you. There's lots of good people I work with who are on the edge. They are, especially some of the nurses, they are just on the edge. They've had enough. And they say the same thing that I said. When they hear that hero nonsense, they roll their eyes. We're not heroes, they say. We're doing the job we know how to do. Give us the resources we need to do it. That includes everything from personal protective equipment. You will remember that our nurses were using garbage bags for PPE because we outsourced everything. This starts under Reagan and continues under Clinton and continues to this day, although it's maybe going to start to be reversed, because it's cheaper for manufacturers to use low cost, call it slave labor, if you will, compared to the American workers who should be making this stuff and should be unionized and should be paid a proper wage. I think we can do with a few less billionaires and a few more middle class types.